I am Agustin Ibañez. I am the director of the Latin American Brain Health Institute. I am also Senior Atlantic Fellow of the Global Brain Health Institute and Associate Researcher of the Trinity College Dublin. Across Latin America, one of the huge barriers for having a better care, research, and intervention for dementia is the lack of awareness and the huge bias and prejudice that exists across the countries. So this means that people doesn't talk about dementia. People feel guilty for having dementia or having a relative with dementia. The people often doesn't know about that. I still remember a small town in Colombia, the second largest population in the world of Huntington disease. And the people there, 10 years ago, still were thinking that, it was kind of magic stuff, not a biological process. So we need to talk, to educate, and to create awareness. In particular, in Latin America, the caregivers are among the highest people with burden. They have the highest burden across the world. And this is because a combination of factors. First, because there is no awareness, there is a lot of prejudice, but also because there is no formal long-term care. The health system are fragile, fragmented. There are a huge bias in the gender. So between 70 to 90% of caregivers are women, wives or daughters. That also impact in their own careers, in their own economical situations. So we need to have at least two things. First is to educate and to talk about that. And I think that the action of world leaders, young world leaders on dementia, and this kind of platform, raising the voice of researcher, clinician, and patient is of critical importance for that. Inviting patients and families to talk about, to create communities, and for researchers, doing a research that have an impact in the community, not only, regarding, biomarker results or clinical trials, but also improving the community voice, improving, the reality, the awareness about the realities that face the patients in the region are really, really relevant. I think that we need first like short-term actions. These short-term actions, requires, helping caregivers, training them, trying to engage patients in the community. But then we also need, the governments to create more focus on that. In Latin America, there are huge other health critical needs, like the childhood or nutrition, but we need to think also in aging. And we need to create a specific policy actions. In fact, in Latin America, only Chile have a real national dementia plan with an adequate budget, we could say. That is not the case of other countries like Argentina, that at some moment they had a national plan, but not anymore, or other countries that they have a plan, but without resources. So those are the really critical actions. But then we have, like more long-term actions. These long-term actions can be included within what is so-called brain health diplomacy, like trying to coordinate efforts for international stakeholders, like, the Alzheimer's Association, but also with research teams, with clinical teams, with private and public centers, and even with the community. When you have a huge tsunami like dementia, you need to coordinate effort because governmental responses won't be enough in the region for sure. So global brain health diplomacy and convergent science can help to coordinate efforts to, making a knowledge sharing between different expertise, between different countries in the region, and create more innovative solutions, perhaps using, telecare, telemedicine, using, innovative approaches that can improve the care and the assessment in the patient. But also we need to create a new narrative of dementia. So as we have a strong prejudice, not only about dementia, about aging in Latin America, we need to change that. We need to show the person behind the dementia. We need to show the positive aspect of aging and dementia, because otherwise, if we not create hope, if we not create a more positive narrative, it will be more difficult to make behavioral changes and belief in the families and in the patients.